Good morning, everyone, and welcome to the Faculty and Staff Town Hall. We've had a little bit of a technical glitch this morning, so I will be participating via phone, and so you won't be able to see a video from me this morning, but this is par for the course, and welcome to our world of Zoom. Before we get started, so my name is Susan Ty, and I'm McMaster's Provost and Vice President Academic, and it's my sincere pleasure to host this event today. So though we are gathering virtually, I'd like to begin by acknowledging that McMaster University stands on the traditional territory shared between the Haudenosaunee and Mississauga nations and is protected by the Dish with One Spoon Wampum Agreement. I wanted to recognize the ongoing uncertainty we are facing as we work through the ever-changing public health guidelines and challenges. As we prepare to start a hybrid fall term, I want to thank everyone for your incredible ongoing work to support our students, contribute to research, and keep our campus running. Simply put, we couldn't have done this without you, and we appreciate everything that you are doing, and I know our students do as well. We are so looking forward to seeing you back on campus, whether you are already working on site or will be gradually returning in the fall or winter. I know many of you, myself included, have missed connecting with colleagues, students, and feeling the buzz of campus at the start of the academic year. Our focus for fall is keeping our community safe, creating the best possible student experience, and supporting the well-being of our entire community, faculty, staff, and students. We held our first campus-wide faculty and staff town halls on June the 18th. We are here again today to answer more of your questions around the fall term. Over the past 2 weeks, faculty, staff, and students from across McMaster have submitted nearly 200 questions about our return to campus this academic year. We will do our very best today to answer the most frequently asked questions and most upvoted questions, as well as cover questions on a variety of topics. The sli.do platform will remain open during this event, so you can add your questions by using the URL and code on the YouTube frame and in the video description. Though we will not be able to answer every question today, we will be using these questions that you submit to the sli.do to continue to update McMaster's Back to Mac website, where you will find information about our gradual transition back to campus, as well as COVID-19 updates. Thank you to our leaders from across McMaster who have joined us today to answer your questions. I'm very pleased to present our panel, Dr. Paul O'Byrne, who's Dean and Vice President, Faculty of Health Sciences, Dr. Kim Dai, who's Acting Vice Provost Faculty, Dr. Arig El-Shavai, who is our Associate Vice President, Equity and Inclusion, Ms. Debbie Martin, who's our Assistant Vice President and Chief Facilities Officer, and Ms. Wanda McKenna, who's our Assistant Vice President and Chief Human Resources Officer. What can I say? We have an amazing group with us today, and they're going to do our best. They're going to do their best to help us all answer questions. So without further ado, I'd like to get started. I just wanted to check in with our folks. Can you guys hear me all right? Seeing we've had problems this morning.
Yes, Susan, we can hear you fine.
Okay, that's great. I just wanted to check in. All right, so let's get started. Our first question that was the most upvoted and most asked question in the sli.do platform was, will McMaster be mandating vaccinations for on-site staff with valid exceptions? And so I want to start by saying we are really pleased with the response that we've received from both our staff and student survey. 93% of our staff and 94% of our students surveyed have indicated that they have already received or intend to receive at least one dose of the COVID-19 vaccine before September. For all staff members, here we go. For all, so this shows a serious commitment across the board, and particularly what the staff have indicated is that 91% will also be fully vaccinated by the start of the term. This really shows how seriously our students and employees are committed to vaccinations, and this really extends well beyond the average vaccination rate in Ontario at the present moment. We're really proud of our McMaster community for being so responsible and stepping up. The situation regarding vaccine requirements is fluid, evolving across Ontario throughout the pandemic. So we are continually guided by our university policies and procedures. As the provincial guidelines have changed, we will be sure to follow all those guidelines. We are committed to having a safe campus, and we have carefully monitored this rapidly changing situation. And we continue to have ongoing discussions. Now, the second question we received, there were a lot of questions actually around masking in the fall term, as well as other safety measures that would be available. And so the question is, will masks still be mandatory on campus, even if the provincial guideline changes? So currently masks are required, and the latest information from the Ministry of Colleges and Universities is that they expect mask guidelines to stay in place for post-secondary institutions. Public health continues to require masking, or in some cases a face shield if masking is not possible for an individual, for indoor spaces and outdoor spaces where a distance of 2 meters cannot be maintained. It is possible that these policies may change during the fall term, and so if that occurs, we will continue to adjust our health and safety policies for the community, but recognizing that we are working closely with public health and our McMaster experts. But students should expect that masks will be required indoors and outdoors where a distance of 2 meters cannot be maintained. All right, moving along. I have a second question here for Wanda, so I'm hoping you can come on the screen there, Wanda. And the question for you, Wanda, is how will the university handle people who refuse to wear masks? Over to you.
Good morning, everyone. As noted, McMaster will continue to follow all public health and government guidelines in the fall, including related to mandatory masking. We do anticipate that all members of our community will cooperate with the masking requirements and demonstrate care and respect for others in doing so. In keeping with this kindness and respect for others, we will take a multi-pronged approach of education, frequent reminders, posted signage, and information sharing to support compliance with masking. If you do encounter someone who's not wearing a mask or face shield, be sure to maintain a physical distance of at least 2 meters when you're on campus, and you can report the situation to your manager or supervisor. We will have guidance documents and processes in place to support some of these situations, particularly in cases where individuals identify exceptions to the masking requirements. Thank you, Susan.
That's great. Thank you so much, Wanda. Okay, our second question is for Dr. Kim Dye. And the question for you, Kim, is if I am teaching in person in the fall and can be more than 6 feet away from all other students, do I need to wear a mask while I'm lecturing indoors?
Great. Thank you, Susan. So yeah, this is a tricky question because I know we're trying to balance the policies that we're following with what we're most comfortable doing in the classroom. So there are 2 policy guidelines that we're following. As Wanda and Susan mentioned, current public health policy in step 3 requires that individuals must wear masks when indoors unless they're sitting in a personal space with a closed door or eating in a designated area. So this will also apply to instructors and teaching indoors. The Ministry of Colleges and Universities has also indicated that even as provincial restrictions are being relaxed in September, such as the 2 meter distancing, that they expect masking guidelines to stay in place for all post-secondary institutions. So Facility Services has ordered some clear masks that will be available for instructors. This can be really beneficial for visibility of facial expressions and for mouth movements that really are important for any conversation. So that would be an option for some instructors. I do appreciate that beyond just being able to see the face, that there are concerns around presenting a lecture and engaging in classroom discussions with students with a mask on, especially in a 3-hour lecture. At the moment, however, the answer is yes. Instructors are required to wear a mask while teaching. We will continue to review any policy changes that come forth, and we will also advocate for policy changes that do not compromise the safety of our staff and faculty and students.
That's great. Thank you so much, Kim. And it's certainly posing a big challenge to us, but we're prepared. We're looking at innovative solutions, and we will do our best to continue to communicate those innovative solutions. We actually have a live question, so I'm going to ask Debbie to come onto the screen. And the question for you, Debbie, is when can people start accessing their offices, workspaces to begin getting ready for the fall?
Good morning, Susan, and nice to see everyone this morning. So the simple answer to that question is that security is looking to open all buildings on campus on the 27th of August. So right now over the summer months, we're in a lock and secure mode with all of our buildings, and those buildings will resume daytime operations on the 27th. So we're looking to have all buildings open between 8:30 and 4:30, effective the 27th until the beginning of September. And then based on the classroom schedules, we'll be expanding those hours into evenings where needed. But I think for faculty or staff who require access to their office, targeting that either the 27th or that last week of August would likely be the safest and most realistic approach for us. Hopefully that answers the question, Susan.
Yeah, that's a great answer. Thanks, Debbie, and thanks for answering that live question here. All right, our next question here is for Dr. Paul O'Byrne. And Paul, the question for you is McMaster will continue to require masking, but not social distancing on campus. Will this apply to all facilities and locations of McMaster, for example, MIP, DBHSC, et cetera?
Yeah, thank you very much, Susan, and good morning, everybody. Yes, indeed, these same protocols that we have been discussing and will continue to discuss will be required at other McMaster facilities and sites, unless that is our faculty, students, and staff are working within a hospital or healthcare setting where, of course, the requirements of that particular site would apply. Now, these protocols include physical distancing, and that will continue until the government indicate to us it's no longer needed. And this is likely post step 3 of its reopening plan. The effectiveness of the vaccines that we have available to us in Canada is the rationale as to why the province is planning to waive the requirement for physical distancing once more than 75% of the eligible population is fully vaccinated. And the combination of masking, high vaccination rates, and other measures, such as improved ventilation, will keep our students, staff, and faculty safe. Our learners, faculty, and staff, as I've already mentioned, in a hospital or healthcare setting may be expected to follow the directions of that particular site. But having said all of that, I cannot emphasize enough that the best approach is to get vaccinated. The Delta variant that we're hearing so much about in the past few weeks is estimated to be roughly 50% more infectious than the Alpha variant, and as such can spread much more easily in any environment, particularly among unvaccinated individuals. We now know that the vaccines provide excellent protection from severe infections and very good protection from mildly symptomatic disease and even from asymptomatic colonization. Particularly importantly against the Delta variant. And so the bottom line is that the impact of the Delta variant on the community at large and the McMaster community will very heavily depend on the percentage of individuals vaccinated in the community. And vaccinated and otherwise healthy individuals have very little to be concerned about in regards to the COVID-19 virus, regardless of whether it is Delta or other variants of this particular virus.
Thank you so much, Dr. O'Byrne, for that. And we actually have a follow-up question for you as well. And that question is, what protocols are in place should an outbreak occur on campus or if there is a spike in cases across Ontario?
Thank you again, Susan. So the university has had protocols in place since the very beginning of this pandemic. And these include the fact that when a university is notified that a student or faculty or staff member has a confirmed case of COVID-19, cleaning and disinfection of the affected area is completed in compliance with the public health guidelines. In addition, public health do the contact tracing to identify individuals that may have been in close contact and may be at risk. Public health will contact those individuals directly. I think it is really important to emphasize that our faculty, staff, and students should all continue to self-monitor for symptoms using the Ontario COVID-19 assessment tool and get tested even if these symptoms are only mild. And if you test positive for COVID-19 and have been on campus, you need to report this through Mosaic. Now, these protocols have been in place, as I've said, since the very beginning. And fortunately, McMaster's campus has experienced no outbreaks of COVID-19, despite the fact that we've had critical operations and teaching continuing to take place on the campus. And once again, to stress this point, the best approach to get us through this pandemic is to get vaccinated.
Thank you for that, Dr. O'Byrne. And just, to reinforce, we have had a number of people that since the start of the pandemic have been working safely on campus and have been following all the protocols. So we know it is possible as the broader community starts to come back to campus. All right, so the next question is actually a question that I'm going to start to answer, and then I'm going to ask Wanda McKenna, our Chief HR Officer, to help me with it. And so the question is the university planning on offering rapid asymptomatic COVID-19 testing for staff required to work on campus, and will staff be getting paid time off to get tested? Okay, so I can say that we have a group of McMaster experts that we are working very closely with currently to determine what the best testing protocols are based on scientific evidence and the advice of public health. And what we do know is, and we continue to discuss, are various aspects of asymptomatic testing. And the majority of testing has and will continue to be provided by Hamilton Public Health. And so in the event that there is an outbreak, testing protocol is being finalized so the university can respond quickly. And of course, this information, as it becomes available, will be available through the Back to Mac website. Wanda, did you also want to tackle this question as well from an HR perspective?
Thanks, Susan. Why don't I start by saying that as we announced last spring, all employees are eligible for up to 3 hours away from work without loss of pay on 2 occasions to get their COVID-19 vaccinations. And we actually saw a large number of employees that used this time to get vaccinated. With regard to testing, there are many options for testing throughout the public health clinic, healthcare providers, or your local pharmacy. If you are symptomatic and need to get tested during working hours, we do encourage you to speak with your direct supervisor and that you can confirm arrangements for time away from work. Thanks, Susan.
Okay, great. Thanks, Wanda, for that so much. And again, apologies for my video not working this morning. It's making our transitions a little more choppy than they have been in the past, but certainly we're here and we're taking live questions as we did before. So now the next question I have is, will everybody be required to do COVID assessments before coming to campus? And if they fail, especially for essential staff, how do we make sure that we feel safe? And so again, I would like to reiterate that since the beginning of the pandemic, the university has been following the provincial screening requirements. And the provincial COVID-19 assessment tool, as you've heard about already, continues to be required for everyone in the hour before they come to campus. It remains a critical piece of our COVID-19 response to keep our campus safe. And we really do want to protect all of our community members. We want you to monitor for symptoms and get tested at the first sight of symptoms. And when you feel sick, please stay home. And we will, of course, continue to monitor any Ontario changes that are coming through based on our policies. All right, the next question here is for Wanda. And the question is for you, Wanda. Can I refuse to work closely on campus with someone who refuses to get vaccinated, not for health or religious reasons, and doesn't follow COVID rules anywhere? Wow, that's a really tricky one. Wanda, over to you.
Thanks, Susan. I appreciate that. And I should note as well, we're also getting questions with regard to mask compliance in similar type situations. As we've been saying all along, we've had a number of health and safety precautions in place that align with public health legislation to protect employees when they are at work. As mentioned already, we're seeing a strong commitment overall to the McMaster community in terms of vaccination and compliance with health and safety protocols. The university does expect that all employees will adhere to health and safety measures that have been put in place for the protection of the community. I can also note that in accordance with Occupational Health and Safety Act requirements, all employees are expected to follow health and safety protocols in the workplace. Now, that said, there are still concerns about how do you actually respond in those situations. Of course, I do remind individuals if there are specific concerns in your work area, please contact and speak directly with your direct manager or supervisor. We have created a variety of guidance documents and support documentations, and in some cases scripts that will help people work through some of these specific issues. If you have questions, we do ask you to reach out to speak directly to Employee Labor Relations, Health and Safety, or to your local HR contact. We want to understand these issues and to help to address the specific situation. And I can tell you that we will continue to be developing material on this particular item because every situation is somewhat unique. And we also want to respect some of the individual situations that people are presenting. Back to you, Susan.
Yeah, thank you, Wanda, for that. And I just want to also reinforce that, you know, as we come back to campus, we know there are various concerns that are presenting, and we want to work with you to ensure not only, of course, to provide a safe and healthy environment for everyone, but we want to make sure we're addressing any concerns that you do have. Okay, so we're going to shift gears a little bit, and there were a number of questions that were related to work arrangements for the fall. And I'm going to ask again, Wanda, to speak specifically to a couple of these questions. And so the first question is, with the global shift to a flexible work from home structure, to remain a top employer, will McMaster encourage managers to support staff with a more flexible work structure?
Yeah, this is a great question. And again, something that we've been talking about for some time now. Definitely the past 18 months have provided many learnings and opportunities as departments and faculties have adjusted to the pandemic. We all shifted, or many of us shifted to remote work. We had opportunities to reimagine how work is delivered and actually found some better ways of doing things. And I have to say a huge shout out and a thanks to all the faculty and staff who've just been incredible in delivering and making things happen under difficult circumstances these past 18 months. As students return to campus, it is important that we consider how on-campus services can resume while we're also trying to retain some of the good things that we've learned through the pandemic. We have asked units to consider these learnings when initiating new work arrangements for their areas and to engage their teams as part of the fall planning to deliver on their operational requirements. New work arrangements should continue to be reviewed on a regular basis, and we expect that some arrangements may evolve based on lessons learned this fall as we assess arising needs and issues. We have definitely heard that there's a strong interest in hybrid and flexible working arrangements, and we recognize that this is very important, particularly when it comes to attracting and retaining our critical employees. So while we encourage flexibility wherever possible, I think we also need to recognize there are very few roles within the university that can be delivered 100% remotely. Student-facing services will have more of an on-campus presence as the term begins, and we're already seeing more people gradually return so that we're ready for September. We'll continue to be focused on building our vibrant campus presence and experience for all members of our community as we look to also ensure that we're delivering on our academic teaching and research mission. We know that faculties and departments have been working to determine their operational requirements and to be creative wherever possible in terms of how they can deliver services and critical operational requirements while also considering requests from faculty and staff for flexibility. And I can also share there's been a variety of workshops, leadership guides, and facilitated support. So we're here if individual areas need support or looking for some guidance in terms of opportunities and how they can reimagine work arrangements. Thank you.
Yeah, thank you, Wanda. And I just want to reinforce that we are reviewing and looking at the services that can be offered in a more hybrid manner. And at the last town hall, we spoke a little bit about that. But, you know, at the end of the day, it is really critical that we do high quality delivery, especially related to our core mission. And of course, that's teaching, research, student experience. So we can't lose sight of how important that is. But I think the other thing is as we modernize and think about innovations that are happening, not only in our sector, but in other sectors, we can learn from some of the tools and some of the methods that are being used and adopt them and try them at least and see how they work for us. Okay, now a second question here for Wanda is how will employees be supported if they do not feel safe to come back? And this would be related to a health concern or a home situation.
Yeah, that's another great question, and definitely one that we've heard before. Um, the reality is that the university has taken every reasonable precaution to keep employees safe. And I can say the workplace is safe, as demonstrated by the many employees who've continued to work safely since the beginning of the pandemic. That said, I think we realize that given this situation, there are some individuals that are going to have some natural concerns around safety and the return to campus. We have worked carefully to ensure the required health and safety protocols are in place, and our many joint and health and safety committees also work to ensure adherence with area-specific health and safety requirements. We do encourage you to surface your concerns, have conversations with your supervisor so that you can address any specific concern. And when we think about specific information available, I would remind individuals about the COVID-19 training, which is required to be completed by any staff, faculty, or student before they come back to campus for the first time. And I think this will help to answer many of the questions you may have. There's also a number of resources available on the HR website, including in COVID-19 workplace health and safety guidance, supervisor and employee checklists before you return, new workplace accommodation guides, etc. We've also encouraged supervisors to think about ways to bring individuals back to campus for simple gatherings, opportunities to walk around the campus once again and get reacquainted and realize that the environment is safe. You can reach out to your HR contact, discuss individual needs, including requests for flexibility or accommodation, and where there are individual circumstances, to consider alternatives or supportive next steps. We do realize that sometimes there are individual situations that should be discussed with privacy and, of course, in light of the individual's specific situations and need.
Great. Thanks so much, Wanda, for that. Now, we do have a number of live questions around mandatory vaccines and whether we will be mandating mandatory vaccines for our community members in the fall. And, you know, what I really want to reiterate here is the situation regarding vaccine requirements is fluid and evolving across Ontario. Currently, the provincial government has not mandated that workplaces require vaccination. But I would say throughout the pandemic, we have been continually updated our university policies and procedures as the provincial guidelines have changed and the availability of vaccines has increased. And so what I really want to say is we are committed to having a safe community and are carefully monitoring this rapidly changing situation. And we are having ongoing discussions on this key issue, not only internally with our McMaster experts, but also with public health and the sector more broadly. So we will continue to be nimble and flexible, but this is definitely a changing landscape. Okay. I wanted to come back to you, Wanda. I have a question here related to whether staff who have children under 12 years of age will be allowed to continue to work remotely if their jobs allow it until a vaccine is approved for their children. And then a second part of this question is, can I request to continue working remotely from home even if staff begin working on campus? So over to you for that.
Thank you. So as mentioned, with the increasing presence of student, patient, and community members on, of course, on site, there are very few roles at the university that will be 100% remote on an ongoing basis. And of course, some of these questions are very difficult to answer because they're really situation specific. I can say that we're proud to be a student-facing institution, but we also recognize, of course, our employees do have families, and we do appreciate that we are a family-friendly organization. We know that faculties and departments are working through planning for returning to student-facing roles to campus with some remote options, which will also help to enhance accessibility and service delivery while also providing flexibility to staff. We appreciate that vaccination in children is pending, and it is causing angst in some of our community members that do have children below the age of 12 that are not yet able to be vaccinated. Public health measures in childcare settings and school settings certainly continue to also be developed. What the best we can suggest at this point in time is that we'll continue to encourage flexibility and compassion as employees make arrangements to return on site during this transitional fall period. Ultimately, a discussion with your immediate supervisor is the best course of action to discuss individual scheduling needs and requirements. Thanks, Susan.
That's great. Thanks so much, Wanda. And so I'm going to now ask our Chief Facilities Officer, Debbie Martin. There were a number of highly upvoted questions related to your area, Debbie. But the question that I'm going to ask you right now is there any guidance on what in-person events are permitted on campus this fall? And for example, are there any limits in the number of attendees or removing masks to eat indoors?
Thanks, Susan. So I think everyone is super keen to get back on campus and begin having events with staff members and with students on site. And I think everyone's really excited about that, including me. I would say with this one for events in particular, we don't really have all of the answers for this yet. We're working as a group to develop guidelines for events on campus, and those are under review and will be shared with the campus community really soon. So we're hoping over the next week or so, we will have some guidelines out around a gradual re-entry of some of these types of events at different stages over the fall semester, as well as ensuring that health and safety measures are in place and making sure that people know what those measures will be for any events that are approved. Obviously, there's a difference between indoor and outdoor events, so we're working our way through those. So hopefully people can be a little patient as we develop those guidelines, and we'll come back with some more information on those over the coming days.
That's great. And I did have the opportunity to go to campus last week, and I have to say it's just beautiful. It looks fantastic. And I did notice there's a number of wonderful outdoor spaces in preparation for, the fall term. And so looking so forward to seeing those spaces being utilized by our faculty, staff, and students. I just wanted to thank everyone for tuning in. We have over 600 participants participating live. It's unfortunate we can't see all of you, but we're certainly really pleased that you're participating with us this morning. Thanks so much for making time. All right, we have another question here, and it's related to truth and reconciliation into the fall. And I would like to invite Arig El-Shabaya to speak to this question. And so the question for you is, Orange Shirt Day is on September 30th, but beyond that, is the university planning any ongoing initiatives around truth and reconciliation? Over to you, Dr. El-Shabaya.
Okay, thank you, Dr. Susan Tai. I'm just noticing, I'm not sure if folks can see me. I've had some technical difficulties as well. So I appreciate everyone's patience. This is an important question, and it's a reminder that we're thinking always through an accessibility and equity lens. These last 18 months have been obviously a real challenge with the pandemic, and they've shown us how the pandemic itself has exacerbated some of the access and equity issues we have been attending to. But also it's been, as folks know, trying with respect to some of what we've experienced with respect to anti-racism priorities, Indigenous priorities. And in particular, we are still impacted by the recent and ongoing discoveries of unmarked graves of Indigenous children. And it's been a devastating validation of the testimonies we heard through the Truth and Reconciliation Commission process. So it's an important question to remind us that although Orange Day Orange Shirt Day is a critically important day in terms of symbolically in large numbers demonstrating our commitment to Indigenous priorities. It raises awareness, it reaffirms our commitment, and underneath the question is what are we doing more systematically, and how are we going to sustain efforts and move from commitments to actions. And I can't preempt Indigenous colleagues who have been working really tremendously over the last many years. The Indigenous Education Council is about to launch an Indigenous education and research strategy in the fall. So stay tuned for more information about that strategy, because that gets at the heart of this question, is a systematic approach to Indigenous priorities. In the meantime, I will say that the Equity Inclusion Office is doing its part in terms of education, educating the community, and in partnership with the Indigenous Education Council, Indigenous colleagues, we have hired Caitlin Knott as our Indigenous Education Coordinator. Our email address for folks, again, is equity@mcmaster.ca if you have questions. And I will send out another email for folks who may be referring students, Indigenous students who require support, and that's to the Indigenous student services, indigenous@mcmaster.ca, and they have a whole suite of support services for students. Thank you.
That's great. And you're in good company this morning, Irene, because I'm obviously having problems with computers too. So it's just par for the course, but we soldier on here. So thank you so much for that. And I just also wanted to acknowledge our colleagues who are Indigenous colleagues who have been working really hard through the McMaster Indigenous Education Council. And we have a number of very active members of the community, and the administration is very, very committed to working closely with them as they launch their strategic plan in the fall. So we're very excited to be having such a great group of folks to work with. All right, so Debbie, I'm going to call you back here because we have a number of questions around our facilities and campus spaces in the fall. And so I'm going to ask you a couple of questions, but the first question for you, Debbie, is last town hall talked about on-campus buildings, and how will MAC handle off-site buildings? So for example, 1 James North. So all employees have the same safety as is the case on campus in terms of ventilation and cleaning. Over to you.
Thanks, Susan. That is actually a really, really great question. So thank you to whoever submitted that question. We are working with the managers of the buildings that are off campus to be sure that those buildings also adhere to the same guidelines as we're providing on campus. So things like cleaning and disinfecting of high touch surfaces, that will for sure occur at all off campus locations. As well, we've shared our guidelines for ventilation with our campus facilities partners off of the main campus site, and we're encouraging them to maximize fresh air indoors. Our utility staff is now starting to meet with each of those sites just to be sure that it's super clear what's happening on campus and what we can hopefully expect from our other partners. So we're working our way through that, but I do want to thank you for that question because it was a really, really good one.
Okay, sounds great. So now, Debbie, there are many outdoor spaces. We've talked about them already. And so they're going to be available for meals, breaks, and meetings. So what's going to happen during the colder months?
Yeah, so good question again. And, you know, obviously while weather permits and into the fall, we're really hoping that we can utilize those outdoor spaces. But we do know that the weather will turn and we will be required to be indoors more and more as we get later into the fall. We have communicated with the Student Center, and there are seating and tables that will be available in the Student Center, again, in a socially distanced way under the Step 3 guidelines, and we'll be watching and monitoring that as we move out of Step 3. The employee lounges will also be open again on campus. So there's 8 of those on campus, and those will be available for people to eat their lunch indoors. And obviously, just a reminder that people can take their mask off when they're eating or drinking and then put them back on again when they're finished. And that the tables in those lounges and in break areas are currently spaced 2 meters apart. But we also expect public health guidance on this topic will evolve over time, and that we'll continue to adjust our protocols for these spaces to adhere to that guidance. So we're hoping this will provide a few additional options indoors for people, as well as those outdoor options that we're really hoping we can utilize well into the fall.
That's terrific. Thank you. And again, as a reminder, as public health guidelines change, so will our policies be adapted. So we're optimistic that as the fall progresses, we will have more flexibility, certainly, in the usage of spaces and how we use our spaces on campus. So thanks so much, Debbie, for answering those questions. So now I'm going to actually call Kim Dye because we have a number of questions, of course, related to teaching guidelines and expectations for instructors for the fall. So Kim, we have 2 questions here for you. And so the first question is, will there be guidelines issued regarding scheduling and delivery of graduate courses?
Thank you very much, Susan. So graduate programs have many distinct requirements. Some are course-based, some are research-based programs, and they operate differently. Also, most graduate courses are smaller and offered in faculty-owned spaces, which is great actually because it provides for much more flexibility and responsiveness to changing policies than does our very complex undergraduate scheduling. Each faculty is going to be responsible for making decisions about their own programs. Deans are working with their programs to create guidelines across broader areas within their faculties, but those specific decisions are expected to be made within a department. Doug Welch, our Dean of Graduate Studies, has indicated that graduate students are expected to be on campus in the fall term. And this means that in some instructors, this also means that they should be able to be on campus or able to get to campus. Some instructors may wish to offer courses with in-person delivery for the fall. Others may feel that they have the flexibility afforded by some of our technological tools to provide virtual discussion, and that this works well for them. Asynchronous content is much less common in graduate courses, and so we don't really expect to see much of that. In terms of grad students being aware of how their courses are being delivered in fall, grad students should contact and connect with their grad program offices prior to the term if they have any questions or concerns about how a course is being delivered. In addition, most graduate programs will be providing a broad selection of courses offered in virtual or blended spaces with remote access options. So students who are unable to come to campus for any reason during the term will be able to make reasonable progress in their studies. The Associate Chair, Graduate Studies, or the Grad Director of the program should be consulted for any recommendations on paths forward for individual situations where students are finding difficulties in attending campus.
Okay, good to know. And again, with the graduate program, there is a little more flexibility because the classes tend to be smaller. And, for our students, you really should be contacting the instructors to check and see what their plans are for the fall and, so that you're prepared and know where you need to be and what the expectations are. Okay, so Kim, for courses labeled as in-class courses, will staff have the flexibility later on to deliver lessons in a combination of in-class and online sessions? So in other words, blended.
Yeah, thanks for the question, Susan. So I'll answer the question based upon my interpretation of later on. So in the fall term, if public health guidelines change, courses may unfortunately need to pivot from in-person to remote. If you are already scheduled for in-person delivery, you may also wish to begin the term remotely and move to in-person delivery in the second or even third week of classes. And we do afford you the flexibility to make that decision. I know that there was another question that came live, which is, will faculty with in-person components be permitted to teach from virtual if and when they want, especially if they're feeling ill or if they feel unsafe on campus? We do absolutely recognize that instructors may find themselves in a situation in which they're asked to isolate for a short period of time if they're feeling ill, if they're not passing the COVID assessment test, or if someone in their home is asked to isolate. And I know, again, this is especially true of those of us with young kids at home, as they might find that they need to offer support for those kids if they are being pulled from their classes. And so there may be needs that come up that in which instructors need to offer remote instruction at some point during the term. And we absolutely trust you to make the responsible decisions that are best for you and your students so that you can maintain continuity of your instruction. We will all need to be flexible in switching instruction modes based upon external, internal, and personal drivers. It would be very appropriate to share such decisions with a program lead or chair or director so that any concerns can be addressed proactively and students are aware that this decision has been made in a consultative way. It's also essential to be very clear in your communications with students, with as much advance notice as possible and clarity on how, again, the continuity of their education will be maintained as there might be a shift from in-person to virtual. The other piece of that is long-term. I do expect that we'll be taking many of the lessons learned in the past year into our future teaching. Remote and blended learning options allow us to use technology to enhance learning rather than replacing what we're doing well. Some technologies, such as online discussions, work better for many of our students. They're more comfortable contributing to a chat or contributing online than they were contributing in person in a classroom. And captured lectures using Echo 360 provide increased flexibility and also accessibility that benefits all of our students. So I expect that we'll continue to use those tools, which might mean that we'll see an increase in courses that are offered in hybrid and blended formats. But I would like to emphasize that these decisions should always be part of a broader departmental and program planning process.
That's great, Kim. Thank you very much for that. And thanks for taking the live question. And we have another live question here for Debbie Martin. So Debbie, I'm hoping you can come back here on the screen. And the question is, there haven't been thousands of students on campus. That's why it's been safe so far. Come September, how are you ensuring safety in high traffic areas?
Thanks, Susan. So as everyone I know has said a few times, we're really carefully following the public health guidelines for spaces on campus. So we'll continue to follow the provincial direction, which has up until now given us some really good guidance on the number of people allowed in spaces, whether they be within a building or an entire building, indoors or outdoors. So we'll continue to look at this. We'll look at it for classes, administrative areas, and events, and we'll follow those guidelines. We already have signage on all of our buildings on campus. And for those of you who haven't been on campus for a while, you may not know this, but we did do some floor signage, some, keep moving type signs, as well as signs coming into buildings to remind people of our public health requirements within buildings. And that signage is all being updated over the coming weeks to remind people about things like wearing masks, keeping moving indoors, socially distancing, especially in eating areas. And I would say that, Kim and Susan and their teams, as they've been planning around classrooms, we have done classroom capacities in conjunction with their offices for the fall, allowing for social distancing. So if that's required, or if we have to pivot back to that, that planning has already been done. And we know administrative areas on campus are focusing on providing service, but they're also going to be looking to make sure that there's distance between staff. So it's kind of a multi-prong approach, I would say, Susan, but our focus is really on ensuring that people are safe as they return to campus.
That's great, Debbie, and thank you again for that. Really discussing the planning, because there has actually been extensive planning behind the scenes with respect to these all areas, but especially the high traffic areas, because we know how important it is to feel safe, especially in these areas that are so vibrant for the McMaster community. I guess the other point that I just want to reiterate again, the best line of defense we have is that we go get vaccinated. And, given our numbers, we have very high numbers, 91%, 94% of people being said that they will be vaccinated, 97% of our students moving into residence, and of course we're requiring them to be vaccinated now. So again, we are planning, and we're going to be prepared for anything that comes our way. But again, we cannot really reinforce that the idea around vaccination and how important it is to keeping all of us safe. Okay, I can hardly believe it. We're getting near the end of the session here, and I have a couple more questions left for Wanda related to workplace arrangements. So Wanda, I'm going to ask that you do your best to answer these next two questions in a brief manner, so that in case there's any live questions we need to take, and we can wrap up. So the first of the last questions is, how much notice are managers required to give to staff who need to return to campus?
Yeah, and Susan, just so you know, we're continuing to receive some live questions actually related to this particular question and the next one that I'll try to incorporate as we go. So as we think about how much notice, we're actually hearing questions as well about when will we receive information about whether we'll be required to return to campus. And of course, it's difficult for me to give specific answers, but I can suggest that we've asked supervisors to provide as much notice as possible to their teams so that individuals can make necessary arrangements required for the return to on-site work. And for individuals to think about the fact that we are temporarily on-site, even though this has been going on for an extended period of time, and work is normally on-site. That said, we know that things have been changing. Things have changed over the summer more rapidly than we would have anticipated as well. We continue to look at the fall as a transitionary period. And amongst all of that, we encourage individuals to be compassionate, to have conversations, to be flexible, and to work to understand that sometimes there are challenging home situations that individuals need to work through as they plan their return. We've said throughout, of course, that we are student-facing. We're bringing back our student-facing individuals first as well. So within all of that, we're looking for notice. We're looking for opportunities for individuals to be involved in planning so that they can understand requirements and prepare their home life so that they can transition back to campus to be there to deliver on their operational requirements.
Okay, that is terrific. Thank you, Wanda. And then this is sort of a similar question, but you haven't quite exactly tackled it, I think, and it's a bit of a different perspective. So during the first town hall, it was said that the final decision to work at home or in the office is going to be up to the individual campus manager or dean, for example. So why not a more equitable arrangements that are being made, or how are we really ensuring that they are equitable?
Thanks, Susan. What I'm going to do as well, we've got another live question about, have you given managers guidance for backup for when a frontline staff is sick to ensure that operations are not impacted and ill staff members stay home. So maybe I can work through both of these topics together as time ticks. As
Yep,
we've said
that's
throughout,
great. You've got a few minutes, so please go ahead.
okay, thank you. The situation has changed quickly, and departments and faculties have been asked to plan with their areas to deliver that meaningful student experience. Dependent on the role, there may be some added flexibility and opportunities to leverage the learnings from the past 18 months, but not all areas deliver the same services or have the same operational issues. Sometimes even similar roles in different departments can have different operational needs. And we do encourage leaders, as I've just said, to work with compassion and to be flexible as possible. But giving those operational requirements is the reason why we're asking and looking to our leaders from across the university community to set and determine the operational requirements and staffing requirements for their particular areas. Those who are not in student-facing roles will be able to transition back to campus more gradually throughout the fall as we progress towards a more normal winter term in January. We know that many of the faculty and staff have been extremely productive working remotely and have realized the efficiencies, as I mentioned earlier. And of course, we are hoping that we learn from all of these opportunities and have a productive fall. Now, with regard to the question with regard to backup opportunities, I'm actually going to suggest that making arrangements for backup plans are a normal part of planning for operations. Not only do we have opportunities or situations where individuals might be sick, but there's vacations, there are other types of leaves that can emerge. So a normal part of operational planning is to ensure that we have some of those backup arrangements in place, or that we're able to quickly think through and be nimble in response when unexpected events happen. So those team conversations, those discussions, those levels of awareness as to what's happening within the specific site are critically important. If you need additional support related to fall planning, health and safety, employee and labor relations, our OD teams, your local HR contact, we've got many different people that are available to help areas work through some of these specific questions, and we'd be more than happy to do so. And back to you once again.
Oh, that's great. Thank you, Wanda. And would you believe it's already 58 minutes into the session? So it's that time that I'm going to wrap this session up today. Again, I want to thank everyone for joining us today and for asking your questions. We really have had a diverse group of questions. They've obviously come from various areas within the university, and we appreciate that. And we want you to continue to ask questions and contact us if you have any concerns. And just remember that these questions, that in the event that we didn't answer them today, I know that there were several more live questions that came in that we couldn't get to, that we will be actually answering these on McMaster's Back to Mac website. So please check it frequently. And again, I can't reinforce enough that public health advice continues to evolve, and we are working closely with them and monitoring the situation so that we can actually ensure that we have our university up to date and operating as efficiently as possible under the guidelines. I just want to thank our panelists today. Great responses, and thank you for taking time to think about the answers and prepare the answers for us. I also wanted to recognize the staff, especially today with some of the glitches that we encountered. I want to thank our event co-leads, Robin Obermeyer and Tina Depko, and our technical lead, Dan Kim. Thanks, Dan, for trying to help us work through our issues today. I also wanted to thank our event facilitators, Monique Beach, Mary Taz, Christine Yashu, and Megan Biaxa. So thank you so much for helping us with this event. We are looking forward to seeing all of you this fall, whether you'll be joining us virtually or returning to campus. And lastly, please take care of yourself. Enjoy the rest of the summer while the weather is great. And we do look forward to seeing you soon on campus. Thanks, everybody, and see you soon. Bye for now.